going all the way back to high school, is that a social worker came to speak to our civics class, and I thought, I want to do what she's doing. As I was working on my degree, I did some volunteer work at a state hospital for people with mental health conditions. I was able to visit people that didn't have anyone visiting them. Then I got my MSW and started working in the field of child welfare. I saw that mental health kind of permeates everything. Back in the 70s, people's attitude toward mental health conditions were not as accepting and positive as they are today. I saw over and over the need for adequate mental health services because mental health counseling could really make a difference in the lives of both the parents and the kids.
She started with counseling young mothers and placing babies with their forever homes through adoption. I remember growing up and we would have foster babies stay with us overnight until care could be provided.
I've been fortunate that I had a really good career at a social service agency that allowed me to do direct service and also leadership. And then after I left that organization, I was really lucky to come to the St. Louis County Children's Service Fund to help make decisions about funding mental health agencies.
She started with St. Louis County Children's Service Fund more than 8 years ago. She's been instrumental in really shaping the direction of the Children's Service Fund. We are responsible for the allocation of nearly $52 million, and she was really at the forefront of those funding decisions.
Sustainable funding is critical. I've been on both sides of the coin with this. I worked at a mental health agency that provided services, and we were always looking for funding to meet the demand for services. On the other hand, for the last 8 years, I've been a funder making decisions about mental health services and funding them. And it's just so important if an organization has quality mental health services for them to continue the programs that they have.
She leads from her heart, and she is absolutely committed to keeping the mission of our organization at the forefront. She's built relationships, and those relationships have led to significant improvements in the field of children's behavioral and mental health.
It's no longer as big a stigma to seek out counseling or psychiatry or get a psychological evaluation. So people feel much more comfortable seeking the services that they need. The other thing that I think that's really changed the field of mental health is telehealth services. It's made services more accessible and more available. And while we had telehealth services before COVID, the pandemic just really made it a necessity. And we've seen that it can be just as effective as in-person service delivery. I learned right away that for people to get help, they needed resources, they needed education and advocacy. Sometimes it's just really simple, like someone finding out that what they're going through is normal. Sometimes it's more complex, they need a lot more help. But organizations like NAMI give people those resources.
My mom's career has been vast, and she's always integrated mental health into our lives.
She's kind of a rock star in the social work community. The list goes on and on. There's so many people she's impacted, either through work, just her coworkers, and everybody that she's ever impacted. I mean, it's got to be thousands of people.
She's been a great role model of the difference one person can make. She started when women weren't a big force in social work and has really built that and is now kind of champion for minorities and diversity in different ways. And we're just so proud. It's the best role model you could ask for.